As I mentioned, our session right now is going to be sickle cell, what every parent and patient should know. And you're going to hear from individuals living with sickle cell disease to really give you insight about what those things we need to look out for, particularly as sickle cell patients, as we go throughout living a productive life. So I'd like to start right now by introducing you to our first panelist, and that's going to be Fitzann Howell. Yes. Fitzann Howell is an esthetician, administrator and advocate, as well as a massage therapist. But most importantly, she is a sickle cell warrior. Diagnosed at 5 months, Fitzann learned that it was an obstacle to overcome. Fitzann has been a part of various committees of SCAGO, such as the Education Committee and Patient and Advocacy Committee, and has always been an advocate for not only herself, but for every sickle cell warrior out there. We're also going to have Chantel Kamji, and she is a caregiver, inclusion and accessibility advocate, cultural content specialist, and founder of Translation. Chantel is a mother, caregiver, and passionate advocate for health equity, language access, and cultural inclusion. Her advocacy is deeply personal, as Chantel's daughter was diagnosed with sickle cell disease just at 9 months. She is a vocal champion and caregiver and patient navigating healthcare systems that are often built with cultural or linguistic diversity. She believes that language is not only just a tool to bridge to dignity, safety, and empowerment. So I'd like to invite both Chantel as well as Fitzann to the stage.
Good afternoon, everyone. My name is Fitzann Howell. I am a member of SCAGO. I have worked on the Education Committee, as he has mentioned, and I am the chairperson of the Patient Advisory and Advocacy Council. I always get that wrong. Been a couple years, I still get it wrong. But I don't have any slides for you today. I like to tell my story, and I like to give perspective from my life. So as he said, I was diagnosed at 5 months old. And a woman shouldn't tell her age, but I'm over 30 now, so I've been doing this for a while. When they gave me the topic of what every parent and patient should know about sickle cell, a lot came to mind. And unfortunately, it started with a lot of negative, because as we know, living with sickle cell, it's a fight. Every single day is a fight. So I was able to tailor that down and keep it positive. We're not going to be angry and, torch the place today, but I did want to break it down into a couple of categories. So we're going to start off with the disease itself. As we know, sickle cell disease is the most common inherited blood disorder in the world. And the blood cells last 5 to 15 days, and they're very sticky and very fragile, and this is why we end up in vaso-occlusive crisis, as we all know. Fun facts. We know that it causes life-threatening complications, and this is what leads to premature death for most sickle cell patients, for most lived experience advocates. I won't use warriors because some people don't like that. And we know how it's passed on. One parent has to have the gene, another parent has to have the gene, and that is when we end up with sickle cell. It was a protection from malaria, so, thank God for the protection, but thank God for the struggle as well. Because, it's a struggle on this side. We didn't end up with the good stuff, all the good stuff. And in Ontario, we know that out of the 6,000 of us living with sickle cell, 4,500 do live in Ontario. So we have the biggest population in Canada. Brief synopsis of stuff we all should know already. So I wanted to focus on things that the patient should know, things that the parents should know, and things that we have to address in the healthcare system. I feel like I always have to preface by saying the healthcare system is our biggest, I don't want to say enemy, but our biggest fight. Because we face it every day, regardless of if it's family physician or going into the ER, ED, or even just going to the pharmacy. I've noticed recently that the pharmacy has been giving me a headache for getting my pain meds. I digress. I won't get mad. I won't fight them today. I'll fight them tomorrow. But when it comes to the healthcare system, the one thing that I would pass on to anyone, whether you are older than me with sickle cell or younger than me with sickle cell, you are going to encounter a system that does not like you, that does not care about you, and that does not want to help you. They say they do. They put their smiles on and they try, but they don't want to. So unfortunately, you have to be the one to go in and convince them to want to help you. And that is the hardest part, convincing. There's no reason why I'm in excruciating pain, can't walk, can't feel my back, can't feel my kidneys, and you want me to convince you why I need your help. But it's something that we face every day. And this is why we are here, to get rid of that. But there's still a lot of work to do. In the healthcare system, I promise you I'm not texting, I have my notes on my phone. But in the healthcare system, you have to be prepared for a fight. So a story that I like to tell is one of my mother. She couldn't be here today, but love that lady to death. She taught me what it looked like to fight, and to fight fair and to fight professionally. We all know the stereotype of the angry black woman, and you go in and you kick off the door, and it's a stereotype that we do not want to carry anymore. My mother taught me to walk into a hospital, whether I am in crisis, whether I just need pain meds, whether I need help, and to fight professionally. You're not going to go in there and angry and swearing and throwing things and carrying. They're not going to listen to you. They don't listen to us when we're on the floor crying, as Ms. Lonray said this morning, for 10 hours, screaming. They don't listen. You have to make them listen. You have to give them a reason to listen. You have to prove to them that listening to you is beneficial to them, not just to you. Prove to them that they're getting something out of it. So what I have done, this is just me, nobody's gonna be like me, but what I have done is I walk into every hospital ready to fight, but ready to listen. And I find that when you walk in and you prove to them that you can listen to them, they are more receptive to listen to you. I know the doctors are gonna come down, and when I say listen, I don't mean just take everything they say and take it. I mean, I understand your point. I believe where you're coming from. You have the education, but I also know my body. This is what I normally do. That's fighting. I don't have to throw things. I don't have to yell, scream. That was me fighting. And I didn't need to carry on and be the angry black woman as they want us to be categorized as. That's fighting professionally. That's fighting fair. And I've watched my mother fight for me for years until she taught me to fight for myself. So when you walk into any hospital system, you have to fight. It's a fight regardless of if they know the quality standards and they're ready and they're prepared, or it's a fight whether they don't care and they don't want to tell you about this quality standard, because you are going to encounter at least one person in that ED, in that inpatient unit, that will not listen to you. And that is when you prepare to fight. You have to be prepared to fight. And it sucks because I'm tired of fighting. But, okay. Another thing is know the standards. Know the quality standards. If you can walk in there and fight them on the protocol, your own protocol, on the quality standards that every hospital should be knowing, should be imparting, they can't fight you. They cannot fight you on that. So I've made it a point to know every single quality standard and what it entails and what I need to know and what needs to happen. Because if I come to you with facts, you can't debate fact. So it's good to know the quality standards, and it's good to know your protocol. I have friends in the community, he's not here today, but he likes to tell you he knows his protocol, he knows what he takes, he knows how much. I can ask any one of us, you know what you do at home, you know what your protocol is supposed to be, but some people don't. Some of us do not know what our protocol is. We do not know what we are supposed to be taking. And most of us, because of whether it be the stigma or the pride or the ego at home or around our community, we don't know what we're supposed to do. We don't know we don't like to talk about it. We don't like to share it. So we never use it. You walk into the hospital and you take whatever the doctors give you. You do whatever the doctors tell you. And that's not how that works. I've had a doctor tell me that they're only going to give me 2 milligrams of Dilaudid every 6 hours. No. I take 6 at home on a bad day every 3 to 4 hours. You can't do that. And I fight with facts. They can't debate me. Making sure I covered everything. And from the healthcare perspective side, from the health professional side, the only thing that they would need to know is to listen. So like I said, if you can convince them to listen to you, convince them that this is a partnership and you're not fighting against them, you're fighting with them. Because trust me, just as much as I want to leave, they want you to leave. I want to leave, I don't want to be here. So the faster that we work together, the faster I will get out your way and you can give that bed to somebody else because I don't want to be here. Don't, right? So convincing them to listen is the biggest key point. To the patients and the parents, I'll kind of put it together because it's very similar. To the parents, allow your kids to be kids. Allow your children to be children. I spent a lot of my life as a child growing up and watching my mom and my dad argue about what I can do and what I can't do. Because I wanted to go on a camping trip, and my mom's like, no. My dad's like, she's a child. No, absolutely not. So I lost out on some of the experiences that I could have get out of the child. I did them now, so you know I'm great. But overall, like camping or summer camps and swimming and all those things, these are things that we know sickle cell patients, lived experience advocates cannot do. We cannot do, or we have a harder time doing. If you know your body enough, you'll know what your limit is. And so learn your limits. Learn where your stopping point is. I have friends that like to go out every weekend, party, and drink till they can't feel their face. I have one drink and I go home. I know what my limit is. I know when to stop. Because I know that I'm going to be the one paying for that consequence, not them. So let your kids be kids within restriction. Allow them to experience within that restriction. It's closed. For the patients themselves, remember that everyone with sickle cell is different. Every variation of the disease is different. Not everyone has the same. There's SC, there's SS, there's beta thalassemia, there are so many variations of sickle cell. We are all different, so our experiences are all different. You don't classify yourself because you have sickle cell, it's just sickle cell. Know what you have, understand what you have, learn what you have, and learn to educate those that don't understand. Give yourself grace. I find that a lot of times, whether I'm from my own perspective or I'm talking to one of my friends that lives with sickle cell, we want to do everything and we want to conquer the world and we want to do it all in one day, in one shot. Give yourself grace. We can't. We can, but we can't. Because if we do, it's going to be a hospital visit that we don't want to experience. But give yourself the grace to not be okay. Give yourself the grace to say not today, to say no. Give yourself the grace to be okay with not being okay. Be okay with feeling unaccomplished. Be okay with the story not going the way you want it to go. Be okay with these things. Give yourself the grace to learn, to grow, to adapt, to understand, give yourself the grace. Don't let sickle cell be your limit. I think I'll end with this. I feel like I've been talking forever. I think I'll end with that. Don't let sickle cell limit you. I had a conversation recently, and I can tell my stories. I can tell you about all the bad doctors and nurses, and I can tell you about all the crises that I've had, and I can tell you about my last talk when I was in crisis on the stage and they didn't know, and it was great. I could tell you all those stories, but I can also tell you that I have a nephew. He's 1.5 because I'm an aunt. I can also tell you that I'm a massage therapist and I have patients that look forward to seeing me every week because I help them feel better. I can tell you that I'm a cousin, I'm a daughter. My mom is like my best friend, and she won't go to the mall without me. I don't know. That's her thing now. She won't go outside without me. But I thought I wasn't one of her little friends, but that's besides the point. But you're not just sickle cell. Sickle cell does not define you. You are a daughter, a niece, a father, an uncle, a brother, a sister, a cousin. You are a healthcare professional. Lance, he's a doctor, but he also has sickle cell. It's also. It's not a thing, it's also. So I think we need to keep that in mind, that sickle cell is just an addition. It's not who we are. It doesn't define us. It doesn't make us who we are. It's an addition to who we are. So like I said, who I am, my name is Fitzann Howell, and I live with sickle cell. Thank you.
Hi, everyone. Thank you to Skego for giving me the space to speak today. As you can see, I'm not very used to speaking. I write a lot. I write a lot. I'm an internet warrior. I'm honored to be invited as a mother and a caregiver to a child living with sickle cell, Patricia. I have a background as a cultural content specialist and healthcare access through language access. And I want to share a few things that I've learned along the way, the kind of things that I wish someone had told me early on. Patricia lives with sickle cell, and I'm going to share with you 5 lessons I've learned from my experience. The first lesson is that even great systems and protocol can fail us. Great systems are useless if the information is poorly used or is not used at all. My daughter was diagnosed when she was 9 months old. She's my second child, and it's only with her that I was diagnosed. Living in a country where, before you get married, you need to test when you're pregnant. If your first pregnancy, you need to be tested. You need to do hemoglobin electrophoresis. So when I got pregnant with my first child, I did my prenatal exams like we're supposed to. My regular doctor was a Cameroonian, trained in Cameroon, so he was aware. He prescribed the test, then he left. He went on a vacation, and he was replaced with a doctor from France, where they don't have as much prevalence. So when my results came, she did not raise any concern. I wasn't sick. I was a carrier. She looked at it, yes, she said nothing. I've since realized that it was likely because she wasn't familiar with how serious this could be. So I went ahead, got married, got my child. And when I got pregnant with my second child, my regular doctor has returned from the vacation. He insisted that I redo the test. He said he wanted to see everything by himself. And I'm very glad that he insisted, because The result came back and I was AS, and he looked very concerned. He asked to test my husband, and my husband tested carrier as well. There was a 1 on 4 chance that my child could be SS, but I held on to hope, because in Cameroon, children of parents that are at risk are tested at 9 months. So I held on to hope until she was 6 months old, and she started showing signs. I was bracing myself emotionally, but I kept hoping. Her result came. This embarrassing part is not very long. So I was asking myself, so many emotions, guilt, helplessness. I was asking myself questions that I couldn't have the answers. Why her? Did I do anything wrong? Could I have prevented this? But those questions don't have an answer. So I eventually realized that I needed to ask myself the next best questions. What can I do now? What will I do next? So I became a student of Sickle Cell, learned about the medication, daily folic acid, antibiotics, pain management. Keep an eye on her hydration, monitor her diet, her temperature, her stress levels. Create a safe environment and a consistent routine. This is what we have to do, not just rely on systems and protocols, because they can still fail us if we are not informed, if we don't know the questions that we have to ask. Learned about all of these. At times it gets overwhelming. You need to know. You're at home with a child and something's happening. You need to know if it could be something like this. When you go into the hospital, you need to know before you even get there, you need to be aware of what this could be so that you don't get dismissed, so that you know what to say if you're concerned, or if they ask you to get Tylenol, go home and give some water. Third lesson I learned: let your child's strength guide you. I've had to rush to school to pick Patricia up in the middle of a crisis. Some images never leave you. I feel her crisis in my heart. I think every parent in this room would understand if I say that if you could take it from her, even just for a day, you will. But in the middle of all this, Patricia is growing. This was after a crisis. She's smiling. She's laughing. She's becoming this incredible young woman, funny, smart, kind. She has a strength in her that amazes me every day. After a crisis, she goes back to life while I fight tears. And sometimes I look at her and I wonder, how? How is she so strong? How does she shine so brightly after everything she's been through? Patricia, my baby, you teach me every day that courage, what it looks like, what resilience means. I'm proud of you, and I pray for a long, joyful, and peaceful life. Fourth lesson that I learned from my experience: find your village. Sometimes our immediate environment may not be as supportive or understanding of the seriousness of the issue, especially for us women, African women, women of African descent. We can be guilted or pressured into doing everything possible, this is very specific, to keep growing the family. despite the risk. Or maybe guilted for having had children. I want us to not internalize this type of expectations and criticisms. Sorry, I'm not English native. And I want us to think about what is good for our children first and what is good for us next. We must empower ourselves to make our own choices. Surround yourself with people who support you, not people who judge you for doing something or pressure you to do more. I want to take a moment to speak directly to all the caregivers in the room, the moms, the dads, the aunties, uncles, grandparents, siblings, friends. I see you. You're doing an incredible job. Even on the days when you feel like you're not doing enough, you are. You're showing up. You're learning. You're loving through it all. But don't forget to take care of yourself. Being a good caregiver also means making sure that you're able to give care. I need a tissue. Do not hesitate to use the resources that are available. Let's keep supporting one another. Let's keep sharing our stories. Let's keep pushing for better healthcare, better policies. Thank you so much. More awareness, so that no child has to suffer without adequate care and no parent has to walk this road alone. Thanks to SCAGO for making this possible and for helping with this. The fifth lesson that I've learned from my experience is that advocacy is part of care. We need to get involved in our communities. Many times we ignore opportunities to do things that help us and help what matters to us. I want to speak from the perspective of someone who is an inclusivity and accessibility advocate. I will give you one example. I'm a member of the Diversity, Inclusion and Anti-Oppression Community Advisory Committee at the City of London, Ontario. And I've been glad to find myself on tables where access was discussed, grants were given, and I had the opportunity to support initiatives like LHSC's Black Health Initiatives, and others. They come to the table, they discuss, and I can, because I'm there, I can raise my hand, I can disclose that I'm speaking from the position of somebody who's benefiting who ultimately from this. I'm authorized to advocate, and I do it, and I'm able to influence. So these advisory and advocacy possibilities exist, sometimes in hospitals, sometimes in our city councils, sometimes our job places. Often we're not even aware of them, but they are there, and you can apply, you can volunteer, be a candidate for those. Show up, apply in your city, in your workplace, in your community, and advocate for what matters to you. Another lens that I look at, because this is another, again, very specific, I'm talking about my experience, is through the lens of healthcare access, specifically through language access and cultural awareness. When you are a receiver of care, for receivers, you need cultural capacity. You need to know, she was talking about that, you need to know the system. That is cultural capacity. For the providers of care, they need cultural competency. Many times, they don't have that. Sickle cell is a condition that disproportionately affects people of African descent. In Canada, many in the sickle cell communities are newcomers whose first language is French or African language. And some of the families that are impacted don't always get information in their first language or in a way that is culturally sensitive. When you're sitting in an emergency room, sometimes with a child in pain, you're scared, you're confused, you're overwhelmed. Every word matters. If language is a barrier, it's a missed opportunity for understanding, for care. But when the correct language is used, it becomes a bridge. I had to explain why there are French-speaking many sickle cell patients, French-speaking or African-speaking patients, but it's not really important because I think I'm going to go past the time. What I'm saying here is that there is a business case for offering services to patients and caregivers in their first language. Healthcare access through language access is not a pity party. It is an investment in care that allows patients to receive the best treatment on time so that they don't return to the ER in a worse shape, requiring more resources and costing more money to the system. It's an investment that allows them to be as healthy as possible and contribute to society. Thank you for listening to my story. And thank you to Skego for all the work that you're doing. Thank you to everyone for what you're doing in your families and communities. And thank you for listening to me through my stuttering.
Thank you so much for those two presentations. They were wonderful. Excellent. Do we have any questions from the audience about the presentations? I guess I'll start with a question then. For you, Fitzanne, were you the only child in your family with sickle cell disease? And if so, how did that feel, being the only child in the family with sickle cell?
Hello? Okay, it's on. So for me, yes, I am the only child in my family with sickle cell. There are only 3 of us, and I was the first. For me, growing up with sickle cell, you feel like a burden because once you get sick, it's all hands on deck. So mom had to jump in, and my little sister had to do something, and my dad had to take off work, and you kind of feel like you're getting in everyone's way. And sometimes when people are frustrated, things can come out, and it's like, oh, you're just a problem, like you just bother me. But you have to learn to get past that. I think for most of us with sickle cell, we have felt like a burden, we have felt like a problem. There are stories that I've heard that, oh, you don't want to, even as an adult, you don't want to wake up your partner in the middle of the night because you're sick, because it's another thing that they have to deal with. But I think you have to get past the stigma of I'm a burden to I just need help, right? And it's more so you're doing this for the betterment of yourself and them around you, rather than you're putting them in a position of issues and problems.
Wonderful. Thank you. And Chantel, if I may ask, you said you have to find your village. And so when your daughter was born with sickle cell disease, could you just explain how you found your village, what steps you really took to find those around you that shared the same experience?
Yeah, this is, again, like I said, I had 2 things in mind. The first thing is mine that I wanted her to eventually own her own story in her own time. What I've done mostly is when I have someone, sometimes it's people in the healthcare system. Once it was a pediatrician, an amazing lady. When I was in her office with Patricia at 9 months and the results, there's Patricia's test results, she told me, yeah, cry. But get informed, learn what, it was in 2006, so it was, learn what exists, learn what can apply to you. So I identify her as, that is the first person that was, because you go to the hospital, there are many pediatricians, sometimes this is the first way you learn to advocate. Sometimes you come and they say, why do you just only want to see this pediatrician? There's this other one who is even a specialist. Yeah, I want to talk to Dr. Lamia. She understands me better. this is one way that I learn my village. Another way that I do is, I want to say that Patricia is better at this than me. Patricia volunteers with SCAGO. She introduced me to the organizers of this event. And she's good at looking for care. I mean, people say, yeah, you keep saying it's Patricia. You taught her this, you showed her the way. She says she learned from me. And yes, friends who have the same issue that you do. Sometimes it's online friends who share the experience that you do, because it's not, Patricia was born in Cameroon. There's not immediate, at the time, community of sickle cell patients, because usually there's stigma, so people don't really associate a lot. So it's mostly you meet people online who have the same experience than you do. We share how they did with this, how they did with that. Those become your strength. Around you, you have family members who understand you, who know when you are stressed, you need relief, who know how to, yeah.
Wonderful, wonderful. So, Fitzanne, I know you discussed the healthcare system and the challenges that it presents, but can you describe a time that you had that was really good with the healthcare system, a real productive interaction?
These are far and few in number. One of my better interactions with the healthcare system was probably most recently, the last 2 or so years. There was a doctor, sorry, I shouldn't say nurse, that came to me and was honest. I don't know much about sickle cell, and sat on the stretcher in the ED with me and asked, what do you do? What do you need from me right now? What would help you right now? And just the fact of, one, you're not standing over me, so you took that power dynamic out of it. You sat next to me. 2, my mom looked at me and she's like, is he okay? We were all confused. It was very confusing. But the fact that you took the power dynamic out of it, you took your, I'm a doctor, you don't know anything out of it, and came down to my level and just said, teach me, educate me. And I think that's what we need more from the healthcare system, because we encounter a lot of doctors that are like, oh, I know, I went to school, you can't tell me anything. And it's like, no, same thing that I said, everyone's case is different. Everyone's version of sickle cell is different. I can have SS and her daughter can have SS, but 2 completely different variations of the disorder, right? So what you encounter with me is not what you're gonna do for her daughter. That doesn't make any logical sense. So the fact that he took himself out of the equation and just left it on, what do you need from me? Whether it be a hot blanket, because it wasn't even just like the pharmaceuticals, it was literally, what do you need from me right now? Can I get you water? Can I get you a hot blanket until they get an IV, until they do? He took himself out of the equation and made it solely focused on me and what I was going through at that moment.
Wonderful.
So long, right? You're still young, so from when you were much younger, and you have grown to be this leader that we look up to in the sickle cell community. And when you are now receiving the right care, you've been very strong in letting the staff know. And I think one of the things that I think you've done bravely is you wait till after being discharged, and then you bring it up with the patient relations in the hospital to ensure that the suboptimal care is addressed in all of that. Because to your point, if you are there and you are fighting them, they're not gonna care. They're like, yeah, stay there in pain. It's your problem, not mine. But you try to, let them understand your needs and and you do all of that. But you do not miss the opportunity to let the hospital know that you were there and you received suboptimal care. And you hold accountable those who did not provide you with the right care. And that, I think, it's amazing, and a way that, other peers needs to move forward. Because when we meet with the patient relations in many hospitals and we'll say, our patients are not getting the right care, they say, well, we don't have any statistics. Nobody's reporting. There's no data on that, right? So that is one thing. And then to go to Patricia's mom, thank you so much for being here and for speaking. My thing with the village, you mentioned finding your village. I just also want to add that sometimes we have some peers that may not have family members with them in the country and so on. The patient organization is part of your village. We are a family. Your church or mosque or wherever you go is also part of your village as well, right? So I think we need to expand who is included in that village to ensure that people that might not have maybe even, their own immediate family members are still able to connect with other people. For instance, KEGO has a WhatsApp platform that has close to 500 people on there. And that is a village. It's a community right there. And everyone supports everyone. So I just wanted to make those comments, but thank you to both of you. Thank you.
Are there any other questions? Yes.
Thank you to both. Not a question really, but another comment. It was really, I don't even have the word to say, listening to both of you, both Fitzan, that I know our chair for PAC, and Mama Patricia. It was really reviving, I don't know, like as a caregiver myself, what I wanted to say is with science, with evolution, we know you can have, and I'm wanting to talk to parents or to those who will take that step in the future. Many will ask, like we say, back in our countries, for example, they will ask you to take the electrophoresis and you know your status, so you know to take better decisions. But you can have those tests that will then tell you you can get rid, not go forward and have a kid that will have sickle cell. But when you look at strong leaders, like we say, you look at Fitzan and you say, thank God she's on this earth. And I remember myself, like Mom said, the very first thing that you have, knowing that you had the trait, you met with someone who have a trait and you made the decision to bring on this earth a kid that will have the sickle cell, it's the guilt. Oh my God, I knew better. Why did I? But that lady told me the best gift that you gave to that kid is to give them life. Because there's nothing else that you could do. And we are there to help them, to bring them through it's a journey. Some are more difficult than others. But yeah, it takes all of us. And thank you for making us cry around this table. We couldn't stop. So I just wanted to add that.
Hi, everyone. So I just have something to say regarding sickle cell. I have experience with immigration. Like in 2023, I was sick. Like I was, I came here by myself, and I didn't have anyone to help me. So I got a letter from Toronto General Hospital, like to submit to the Accra immigration so that I can bring my family here. But still, they disregarded the letter and they denied my children's application. So like that, I would like SCAGO organization to, to work on that too. It's something, I don't know where to start from, because then I almost lost my life. Like, I'm here alone, and the doctor said I'm supposed to start my monthly blood transfusion, that I needed someone to stay with me. I live alone in Canada, so, for that alone, I know what I, go through, what I passed through, what I went through. But I wrote a letter to, what was this, the MP, and trust me, they didn't do nothing. They didn't even, it's not helpful. So we need, someone to speak for us too in the immigration aspect, not only in the hospital. Truly, I had an experience with a doctor too, like she said. The doctor, I know myself. Then I was telling the doctor, like, I need an antibiotic. I think I was hospitalized because my mom passed away. So I think I can't, cope with it because she has been the one taking care of me. So when she passed away, I was, a little bit, down. It really affected my head. So I was hospitalized for more than 1 week. And at some point, the complication. So I had, I think it was my gallbladder that was got inflamed or something. So I told the doctor, I said, I need an antibiotic. She said, no, they have to do surgery for you. Let me go and get the specialist. Before I know it, the specialist came. She said, we have to take you to theater. Thank God that the specialist was like, okay, can you tell me exactly what is going on with you right now? So I explained to him, and I said, no, you don't need any surgery. So many times the doctors, that's why if I have my crisis, I don't like calling 911. I'd rather take a taxi and go to downtown, to Toronto General, because they will take me to nearby hospital, and that was not my first time having, something like that with her, that same doctor. At some point she came to me, she said, oh, there's something in your chest, I think you had cancer, without doing tests or nothing. It's like they are killing us with what is coming out from them. Immediately I rebuked it. I said, no, don't say that to me. How did you know that I had cancer? At some point she came to me, she said, okay, they want to do my biopsy, they want to get something from my lungs. So she told me they will open your chest. There were, so many things like that. So she's right. Some doctors are so, so.
I'm not sure if Dr. Sandra Newton is in the room. Dr. Newton leads our psychosocial program and supported a lot of families on immigration matters. So maybe you want to make a comment? Thank you.
Thank you. I've learned to be available at any moment in case I'm called upon, but thank you for the opportunity to comment. I want to say a bit more just to the points raised, and I'm sorry that it's been such a difficult road, and I hope if we haven't connected to this point that we still can. There's a lot, even just the opportunity to speak together and plan together. There's usually something we can identify together to try next. So please, before we leave, let's do that. And thankfully, I'm also joined by others doing this important work. We have Samira for Greater Toronto Area, Stasha for Windsor, and now Aya for London. And we're working actively to make sure that there are well-being coordinators in other parts of our province. I would just say that, and I think we'll talk a bit more about this tomorrow if you're here for that presentation. There are a lot of entry points to work with SCEGO as a person needing support. And the nice thing is that through those conversations, through our committees, folks with lived experience, through just our collected knowledge, we're able to often chart a path. And each one is unique, but the solutions are, may not be. Maybe we can call on something that's worked for someone else before. But I will just say, just in closing, because I know Danelle needs the microphone back, I will say that, it's difficult to have all of those compounding factors, being a newcomer, not having support locally, needing to have some chosen family, which I hope you'll find as becoming a part of SCAGO. And it makes it difficult in good times and tough times. So I would want to inject a message of hope, and I would want you to know that you're joining many others who have walked the path, some of it, and others who want to understand, so we can make better outcomes happen. So I'll give the microphone back. I hope we can connect before I'm just sitting over here. Okay, thank you.
Wonderful. Thank you so much.
Thank you so much. I wanted to say a message of hope. I can hear the stories and the pain. One of the things Ontario Health has been working on the Black health strategy is increasing Black health primary care providers. We know there has been challenges, especially in accessing culturally competent services for Black people. And what we are working on, I'm a director of health in one of the community health centers. I've developed a Black health strategy, which is also developing policies, including human resource policies, to make sure that we hire more cultural competent service providers to handle our people. But also in terms of individual cases, we have Black Physicians of Ontario Association. You need to get connected to that association. It is full of specialists who are Black. The Black Physicians of Ontario Association is there to support any community member with unique problems to have pathways and most competent referrals to the right people. I just wanted to pass that message to you.
Okay. Thank you so much. And I have one more. And this will be the last comment. I think we're running low on time, so.
Is it Fitzanne? I was just wondering what your experience was like in pediatric facilities, and if you had any suggestions for how it can be better if it wasn't desirable, or what things that we can have more of that you did like. I know that might have been a long time ago, but.
So I tell people all the time that my best experiences were at SickKids. Love SickKids to death. If I could go back, I would. But the one thing that I did value, I don't remember the playrooms and the toys and all that stuff, but what I do remember vividly is the ED visits. So the first thing you walk into SickKids, mind you, I'm 5, 6 at the time when I started realizing that this was happening. My mom walks in, my daughter's name is such and such, she has sickle cell. They're literally 4 nurses run out literally at the same time, IV, fluids, pain meds, and my mom's answering the questions. She's registering them at the same time. So I really think that if we could implement that in adult care, I'm just throwing that out there, that would be pivotal, but just to have them on the game, on the ball all the time, for me at least, because I know some people, their experiences were different, but that in itself, and realizing that was every single time that we went to SickKids. I can't remember ever being a time when that did not happen. Even when I was a teenager and was starting to transition out, it was still a thing. You walk in, I have sickle cell, IV, fluids, meds, my mom's registering me. They're asking her all the questions. Has she ever had this? Is this da-da-da-da? I didn't have to worry about any of that. And I think now that we're adults, yes, we have to do all the hard work, but it would be with the quality standards and especially quality standard 3 and the vaso-occlusive. We're slowly seeing that being implemented into the adult care, but that would be my one highlight of pediatric care.
Wonderful. Thank you so much for attending the session today. We've heard some wonderful presentations from our 2 speakers. I just want to end on a message of hope, because I also live with sickle cell disease, and I'll be 54 next year, getting old. And there is hope. We are making advancements, but as you've mentioned, we have to do this as a community. We have to continue to look at what can we do as a community to advance our cause, and how can we be there for each other to work together on improving the strategies to really address not only sickle cell disease, but all blood disorders that are affecting individuals in our community. So again, I just want to say thank you, and I look forward to seeing all of you with the continued summit. Thank you.